So today, if you have any appointments, this week you'll see all the schedules. This month, so when you go forward, like this week, you'll see the past. If today is Thursday, you'll see everything from the when the week began, and if you set the week to begin on Sunday, you'll see all past, present, and future appointments within that week. So the same thing with this month. Until now, we'll give you all that has to do with you since you started using the database. So as you can see here, 15 appointments for this month. If I was to scroll further down, I'll see all my appointments and their respective statuses here, as well as the consultation time. Of course, if I'm logged in as a specific doctor, I should see only my appointments as a physician. So I see my other statistics, average time, if I have any treatments running, and other important things like the invoices that I are linked to me in case I need to calculate my commissions. Although we'll get to that later on. Then we have the discuss application. If you choose to have an internal chat group, let's say with the dental assistants, and you can communicate, send each other messages the way you'd have a WhatsApp group or even other departmental groups. Requisitions is for internal requisitions and external requisitions, which we'll get to. The patient's application here, this one has the biodata of all your patients, and then you can put even the photos, and if they have a primary physician assigned to them, that can be captured in detail. We will create one patient in this video. Then, of course, here you'll see all the physicians, you included as doctor. All contacts, this means the patients, the suppliers, the doctors, and all other members of staff will be captured here. The services are now the services that you offer, like dental services. Then the medicines, of course, if you have a pharmacy, then you can have all that. Treatments is like something like canal treatment. So those procedures that require more than one visit, they can be configured in the system such that they're all captured here. Then the most important is the appointment application. Here you get to have all your appointments scheduled here, and radiologies is where all the x-rays are captured in the system. Then we will look at accounting later on. The insurance bit, I will also tackle it. So I will cover the creation of an appointment, a patient, and all that. So every new action in Odoo is usually, if not all the time, is usually here. So when I click on new, I can input all the data that has to do with this new patient I'm creating. For an existing one, let's say I come to Mina Amina, you'll see these smart buttons. So there's the dental chart. So when I click to open this, I will see her historicals. So anything since the system was put to use here will be captured. As you can see, if I was to click on this, it says a crowning procedure was performed on this tooth. If I was to click on this tooth number 46, I'll see an extraction was performed here. And you can choose tooth surfaces on the dental chart of this patient. You can see all planned and completed procedures. These are planned procedures and some with their different statuses here. I will click here in this down drop and we get to see the completed ones. So here we have just a list of everything, but the completed ones are usually down here. So back to the patient. You can capture the address and all other details. So I want us to create a patient on the fly instead of this. And these smart buttons are saying there are also other features like all documents that have to do with this patient. It could be prescriptions from another facility or any other thing. Then you can preview here. In case of images, let's say you want to view the X-ray images of Mina Amin, then that will appear on a separate page. So you can click there to view. Then treatments and the number of the historical appointments, and you can see a lot more. 10 patient procedures, radiology, and all that. If there are any insurance claims, you will see them here, and all insurances linked to her will be here. So let's do an appointment, and in the process, we create a patient on the fly. So let me say create appointment. I'll come to appointment. So by default, what you see here is what is yet to be done. So if I was to close this filter, I'll be just left with today. If there's anything that has been done or not yet done, now you'll get to see the entire list. But if I close this filter, you'll see everything. So that default filter is just for convenience of seeing what is pending, because that's what is really important as other than the historicals. So I'll click on the top left button that says new. Then I will create a new patient. So I've just typed, I've pasted that. So there's always two options. If you select the first option, it will not be helpful because the biodata will not be fully captured. But when I click on create and edit, then I will get to add the other details like the gender, she's female. Yes, title, it's the salutation, say it's madam. Then we can assign her a date of birth. Say maybe she was born on 1st of 1999, and then I click outside. Or you can select from this calendar, you can pick on the date, but I find it easier. So it auto calculates the year, the age, I mean. Then you can put the address and say South Sea, city, say Nairobi, country is Kenya. You can capture, of course, the phone number. I prefer you capture this with the phone number should be under mobile, because the other one for phone, as it is we're working with an assumption of it being a price, a landline. So we've done that. Then for us to see, so here we can see if there's any balances, appointments, and all that. But for us to see the dental chart, I will click on the down drop here and select the department, odontology, and that way the dental chart becomes visible. Then we can select a dentist in the department. So I'll say Dr. Wilson. If we have consultation rooms, then we can create them in the configure this and say, okay, this is consultation room, and it picks the current time by default. And once you do that, we can save, and we can confirm this. I've did some extra customization to enable you to reset it back to draft in case you left out anything. So in this case, we have created an appointment, and so we can go straight to waiting. So let's assume we have created an appointment. We But this patient has to walk in for you to say this patient is here. So when you click on waiting, you'll see the moment I click on waiting, it will move to waiting. So waiting means the patient is present. And once the patient walks into the doctor's chamber, I'll click in consultation. Notice you'll see a difference here. So at this point, when I click in consultation, the moment we are done with this, we'll be on the last status, which says done. At this point, you can create a prescription, you can send them to the lab to get an x-ray done, or you can say the consultation is done. So here the doctor can record their notes, say toothache, and capture any other details like past dental history, maybe RCT, tooth number 35. Does that even exist? Let's say tooth number 1, 2, and maybe extraction. This is after examining the mouth, of course. Tooth number 4, 6. And once we're done with that, you're done with the notes. Of course, you open the dental chart and now decide what it is that you want to administer as, like you're viewing the mouth, of course. So when I click on dental chart, it will open the chart for me to do my necessary, okay, because this is a patient we just created. So let's say we're doing a procedure on this tooth number 43. Let's say it's extraction. So I'll select extraction and add the procedure. Against it, it's the price or the charge. So as you can see, this is spinning and it's created a new procedure, the dental procedure number 62. That will appear here under a planned procedure until I do it. Then let's say I pick on this tooth, or let me pick on this one and say crowning. So I will select that and I add the procedure. It's DP63, dental procedure number 63. For this to be possible, I'll click on that. So that play button means the procedure is running. Once I'm done, notice once I've done that, the dustbin or the trash can is gone here. So meaning I cannot stop the procedure until I mark it as done. So when I click on done, that would be, there's even an animation to show that there's a procedure that's been done here. And when I come down here, I will see that as a completed procedure. Let's assume also we're doing this. So it's running. Once you're done, you click on done. So if you have other procedures late, like coming that you plan later on, you can select a tooth, select the surface, and select the procedure linked to that surface. And that will appear here once we like when we have another dentist, they'll come and see what has been planned versus what has been done. So I will, to finish off with this patient, I'll click on that home icon and I will go to the appointment from right from here. Go back to this appointment that we are on. Still it's in consultation status because you're not yet done with this patient. So what we'll do is we will create an invoice with procedure right here. So this invoice will include the consultation fees as well as the procedures we've just done on this patient. So once I do that, we'll see this icon here. Click on this invoices, and here you'll see a breakdown of all that we've done on this patient. So here is a breakdown. This is the consultation service, this is the amount, and the extraction is here. I think I've missed a procedure in all this. So what we'll do is we will confirm this. Though before this we can edit before confirming an invoice. Now it has an invoice number. Before that it would have been possible to edit this if the amounts are maybe negotiated. So we can register payment for this procedure. Say maybe they paid via cash, and this is say let's say they pay less amounts. They pay 1,800. For purposes of demonstration, I'll click on create payment. See it says keep open or mark as fully paid. If you leave it as open, of course, you will see what happens. I see this says partial because you've paid partially. Then when you come here, you'll click on this eye and you'll see the method of payment as well as the amount as well and the balance. To print this out, you can come here and print the invoice in PDF. But I'll go straight to registering the balance using a different method. So I can say create payment, it's the bank, it auto calculates the balance and it assumes it's being paid in full unless you specify by keying in the amounts. And we can create payment. You'll see how the ribbon changes from partial to fully paid. So now it says fully paid. So to go back to the appointment, oh sorry, let me just come down here. See now it shows a breakdown of the payments. If I was to click here, I'll see it was paid via Gulf Bank. as, and this one was paid via cash. So, and all the changes that I've done are anyone who's done it, executed any action on this invoice, all these are recorded in these logs, which cannot be edited. So to go back to the appointment and finalize with this patient, I will come to, I just click on this, it's called a breadcrumb. I'll click on that. Sorry. Hold on a second. I think my fingers are pretty quick on this. So I'll come here on this appointment. I know what's it's acting like that, but let me just go straight to appointment. We are done with the billing this patient, which you can see here. This is the appointment that you've just handled and it's been paid. If I click here, AP06, we come back to this appointment and now we can say done. If there was anything to do with sending them to the lab, we would have clicked here, but let me just click on consultation done. And this way we can say we have concluded this. We can see more appointments going forward. We'll do another video on when we have a procedure that involves radiology. Thank you.